anatomy lecture. Define the cell type of the vulva, the risk factor of the cancer. Define the staging, management of the vulvar cancer according to the stage. And we will know the various type of vulvar excision during surgical treatment of vulvar cancer. Okay. طبعا الفولفا is divided into certain anatomical landmarks. I think you took it already in the anatomy. It's mons pubis, clitoris, labia majora, labia minora, peritoneum, perineum, vestibule, and the hymen. Okay, so these are the parts. Like vulvar lesion, طبعا, they are divided into two parts, which is benign lesion or malignant lesion. طيب. Benign, the most common is طبعا اللي هو lichen sclerosis. في عندكم squamous cell hyperplasia. في lichen planus, psoriasis, seborrheic dermatitis. في inflammatory dermatitis, ulcerative dermatosis. So we will not go to all of these. We'll just highlight on the most common ones, okay? لأنه غالبا حتاخذوه في الدرماتولوجي كمان. We will take the most common that comes in gynae clinic. Lichen sclerosis, it's about 70% of non-epithelial disorder. It is characterized by thin and shiny skin. ويكون عندك inflammation of the dermis. Okay, so dermal layer is inflamed and يكون very thin and shiny. كل vulvar lesion تجي ب itching, pruritus, soreness, أحيانا يكون a little bit hotness, burning sensation, pain, and sometimes هنا في lichen sclerosis it will be atrophied, thin and shiny. Okay? طبعا because it is thin ويكون في pruritus, يكون في fissures or يكون عندك scars في المنطقة. Diagnosis is by biopsy. And the treatment is by topical steroids. If you say topical steroid to all lesions, you'll not be wrong. Okay? All of the lesions, topical steroid is the treatment of choice. Except one lesion, I'll tell you what. Surgery, we should avoid the surgery. Usually it will be treated very well with steroid. Unless in the biopsy you find that there is malignant cells. So lichen sclerosis, they have a connection with malignancy, okay? بس مش دائما يعني very rare, but it has a connection. Lichen planus يكون طبعا erosive lesion في الvestibule. Because it is an inflammatory, severely inflamed lesion, it will cause stenosis and shrinking, and يكون عندك desquamative vaginitis. Okay? So يسوي stenosis للمنطقة. The chief complaint is irritation, soreness, burning. The same complaint for all the lesions: burning, itching, pruritus, soreness, pain, sometimes bleeding because of the atrophy and thinning of the wall. So how would you differentiate between this and this? By biopsy. Okay? لأنه كل lesions حتى malignant lesions في الفولفا يكون the same symptoms. كلها the same symptoms. Okay? So how would you differentiate? Biopsy. طيب? Treatment, you can give her steroid creams. هنا it will benefit more with estrogen if it is stenosed and atrophied. Okay? طيب؟ طبعا غالبا local treatment. And you can take help of dilators for a stenosed area. طيب. psoriasis طبعا topical steroid اللي هي treatment حقت psoriasis يعني you'll take it in dermatology more. Lichen simplex طبعا هنا يكون thickened white epithelium. The treatment is steroid. ف more or less كل treatment steroid. كل symptoms the same symptoms. Lesions, the look of the lesions is most of the time the same. Except انه في اللايكن planus يكون stenosed cervix. اللايكن sclerosis يكون shiny and thin ويكون atrophied ويكون في scars. Okay? Treatment is the same, topical steroid, but with stenosis you have to give her estrogen and you can give her dilators. Okay? خلاص؟ Clear?
Clear.
طيب. طبعا في عندك الاكزيما اللي هي يكون neurodermatitis, benign epithelial thickening of hyperkeratosis. طيب. It will be a red moist lesion ويكون عندك pruritus and scratching. Chronic phase will be يعني أول ما يبدأ يكون reddish lesion, scratching and itching, but in later stage لأنه يكون في زي الفايبروسيس يكون whitish lesion. Okay? هنا التريتمنت يكون لأنه إكزيما فيكون antihistamine and sits back. Sometimes topical steroid will work, of course. مع كل الإكزيما طبعا steroids will work. طيب, now the lumps. طيب. The most commonest lump which is there is Bartholin gland. Okay? There is inclusion cyst, skinny duct cyst. طبعا skinny duct is very common. وإذا لقيتوها في ultrasound ولا لقيتوها في any radiological evaluation مكتوب skinny duct cyst, you don't mention it even يعني. It's very common and there is no treatment for it. And she will not even know that she's having cyst, okay? Very small, skinny duct cyst, okay? Cyst of canal of Nuck, which is a hydrocele in labia majora, fibroma lipoma, condylomata, cyst of طبعا الcyst either they are congenital or it comes from obstruction. دائما الcyst يجي بسبب obstruction to a canal. طيب. ففكروا في الجلاندز اللي موجودة في الاريا. The most commonest one is Bartholin gland. طبعا البارثولين gland located in the lower part of the vagina in the 5 o'clock or 7 o'clock. Okay?
obstructed gland صح؟
أيوة. Bartholin gland, the duct of it gets obstructed and then it gets swollen. في البداية يصير cyst. But once it's infected, يصير abscess. اللي هي Bartholin gland abscess.
Yeah, towards the left or right thigh.
يا إما left يا إما right.
وهي الموست كومن صح؟
هي الموست common. طيب تجيك المريضة ب severe pain. It's one of the emergency. The جاتك في ER is one of the emergencies. You have to do an immediate surgery for her. طبعا there is two types of surgery. أولا يا إما تشيل السيست or تشيل الابسس يعني just you prick it and you empty the cyst content, but there is a very high recurrence rate if you do that. طيب. So it will recur, definitely it will recur. The optimal treatment for Bartholin gland is removal of the Bartholin gland itself. So you remove the base of the Bartholin gland, so it will not recur again. طيب. So if you just prick it and take the content out, اسمها merciplization هذه السيرجري. ايش يسووا زي الاكس، فتحة زي الاكس ويخلوا السيست open ويخلوا كل الكونتنت تطلع برا. طبعا with antibiotic. Okay? This will have a very high recurrence rate. The optimal treatment for Bartholin gland abscess or Bartholin gland cyst is the removal of the Bartholin gland itself. خلاص؟ So Bartholin gland are 2 in number, located in the posterior orifice of the vagina on either side. Normally, it is not seen or felt. Its enlargement can be painless, cyst or painful abscess. So once it's painful معناته تحولت إلى abscess. Okay? لأنه any abscess it's painful, right? طيب. Bartholin gland cyst is the most commonest vulvar cyst, usually unilateral and on the posterior lateral side of the introitus. It's usually about 2 centimeter, but you can have 5 centimeter even, يعني من 2 إلى above. Okay? Usually it's asymptomatic, but if she has pain, معناته بدأت تصير abscess ويصير في infection. Okay? Treatment, excision or mastocytization. طبعا the best is excision. Skinny's duct, they are located in the lateral side of the urethra. The symptoms, it can have swollen or tender. أحيانا ما يجي symptoms. إذا ما جاتك أي symptoms, you don't even need it, okay? But if it is swollen or it has tenderness, معناته there is infection. The most commonest organism is chlamydia. Treatment is drainage, culture, and chlamydia treatment. Okay? Fine. Vulva is just like cervix. خلاص؟ الفلفا بالضبط زي cervix. So a causative organism is HPV for vulvar changes. Okay? Staging is the same. في عندك precancerous lesion وفي عندك cancerous lesion. الprecancerous عندك VIN1, VIN2, and VIN3. Okay? VIN1 is a mild dysplasia with hyperplasia. خلاص؟ mild. المودريت يكون moderate hyperplasia and atrophy with moderate atypia. خلاص؟ السيفير يكون severe dysplasia, vulvar dystrophy with severe atypia. طبعا هذا يكون carcinoma in situ. ايش الكارسينوما in situ؟
كل شيء ما عدا البيسمنت ممبرين is fully there.
لا في basement membrane.
كل شيء لا بس ما سوى invasion.
Carcinoma in situ معناته there is invasion of the basement membrane but less than 5 millimeter. عرفتوا؟ يعني تو بادي يصير في invasion less than 5 millimeter invasion of the basement membrane. هذه carcinoma in situ. يعني دخل inside. طيب التريتمنت حقتها you treat it as a cancer. Okay? يعني don't delay your treatment. إذا شفتوا carcinoma in situ don't delay your treatment. يعني مش follow up. لا. الآن you are in a very near to cancer. So you treat it very vigorously. Okay? إذا جاتكم في pap smear ولا cytology ولا biopsy carcinoma in situ معناته it's a very near to cancer. You have to treat it. Okay?
Okay.
Like. So how would you diagnose? What is the symptoms? Like vulvar tumor, vulvar cancer, vulvar lesions,
pain,
pruritus,
burning, itching, redness, soreness, bleeding, atrophy,
edema يمكن
ulcers, dyspareunia. So all of these are big symptoms, right?
Yes.
So how would you diagnose? Biopsy. صح? طيب. So how would you biopsy vulva and vagina? How would you biopsy it? By colposcopy, right? And the same thing, you have to put like lugal iodine, you have to put acetic acid, the same technique with cervical cancer, you have to do it يعني تشوف الميكروسكوب تشوف يعني تشوف الاريا very closely and describe it. Okay. طيب low grade you should observe زي ال CIN you should observe and follow up the patient. VIN3 هنا لا. VIN3 معناته carcinoma in situ, so you have to do surgical removal. Okay? Just like high-grade cervical cancer, what we do? Cone biopsy, صح? We do leaf cone biopsy. هنا we have to do excision. طبعا هنا ما يصير leaf cone biopsy, صح؟ هنا نسوي excision. طبعا types of excision we have either local excision. عندك area فيها lesion, you just excise the area. Local excision. Or you have to do laser vaporization. Okay? أحيانا يكون في vulvar warts or genital warts هنا نسوي laser vaporization. Or imiquimod اللي هي topical immunomodulator. Okay, there is topical cream, you put it for 3 weeks, it will be effective يعني 2 times for 3 weeks.
بدل الفازوبريزين؟
Yeah, بدال vaporization, laser vaporization. So it has, both of them, they have good effect. طبعا laser vaporizations will give you an immediate response, على طول يروح الليجن. التوبيكال اللي هي الاميونومودulator it will take 3 to 4 weeks or even longer to respond. Okay? طيب. Vulvar cancer is one of the rare cancers of gynecological malignancies, predominantly seen in the postmenopausal and old women. طيب. Young patient, rarely you see vulvar cancer. The mean age is 65 years of age. 2% only you find it in less than 30 years of age. Okay? It's common in South African women. طبعا it is sexually transmitted related. Okay? Diseases related. Pathology, طبعا we have primary tumor اللي هي which arises from the vulva itself, or secondary tumor which is metastasis from other tumors. طيب? طيب. In primary you think about the cell type which is in that area, صح? So عندنا ايش؟ squamous cell, which is the main cell type موجودة في الفulva. Okay? So 90% of the lesions are squamous cell. Then there is melanoma, which is 3 to 5%. Then there is basal cell carcinoma, and then there is sarcoma. Okay? So these are the cell types. The most common is طبعا squamous cell, and then melanoma. Basal and sarcoma is يعني مرة rare. Secondary tumors also it's very rare. Okay? عادة من وين يصير الميتاستاسيس؟ ايوه من وين يعني؟ من السيرفكس or من الاندوميتريوم. يكون primary cervical cancer and metastasize to the vulva, or uterine and metastasize to the vulva, which is very rare صراحة. طيب. في vulvar cancer, the main point that you have to diagnose is lymph node involvement. Okay? Very important. If you have lymph node involvement or you took a biopsy of the lymph nodes, the survival rate will be very low. It's about 25 to 41%. Okay? If you have nodes which is negative, there is no nodal metastasis, the lymph node, يكون the survival rate is very high, 70 to 90%. If you understand this, you will understand how would you do surgical treatment for vulvar cancer. Okay?
You remove the node.
Remove
the node.
Yes. طيب, what are the nodes that is involved in vulva? Inguinal. So the most important one is inguinal. الانguinal lymph node وين يروح؟ Para-aortic, صح؟ طيب, para-aortic. There is something known as sentinel lymph node. البارا-aortic يروح لأxillary lymph node. طيب. So sentinel lymph nodes, these lymph nodes should be removed. How would you know the إيش معنى sentinel؟ معناته إنه tumor is going to the lymph node which is related to it. Okay? How would you know it? You put a dye في inguinal area, and if the dye is spreading too up يعني بعدين نسوي radiation وتشوف lymph node which is involved, and then you remove these lymph nodes. Okay? Usually it says superficially هي inguinal lymph node and the axillary lymph node. طيب
الداي ما راح ينتشر خير شر يعني.
ما راح ينتشر الا في المنطقه اللي فيها
متاسس.
involvement. أي.
كيف دكتورة؟ مو في ليمف فلويد اصلا.
هو داي تكنيشن زي الراديو اكتيف.
اوكي.
اي
اوكي.
اوكي. فلما تحطها في هذا just the positive lymph node will be shown to you and then you remove it. Okay? طيب. So staging of فاهمين الفولفر it's very easy يعني ما فيها شيء صراحة. يعني كلها the same symptoms, the same diagnosis, you take biopsy, and then the same treatment as cervical. إذا كان VIN1 you just follow up. إذا كان VIN2 or 3, especially إذا كان 3, you have to do surgical excision. Okay?
هذه clinical classification صح؟
Clinical classification, you're right. طيب. So staging. طيب. Staging. عندك stage 1 confined to the vulva. The lesion size is less than 2 centimeter and the lymph node is negative. طيب هذا stage 1 اللي هي confined to the vulva, the size is 2 centimeter. Stage 2 more than 2 centimeter بس lymph node is negative. خلاص stage 2 more than 2 centimeter lymph node is negative. طبعا staging في stage 1A 1B بس يعني for your level يعني I think this is enough صراحة. This is more than enough حتى. Okay? Stage 2 more than 2 centimeter with negative lymph nodes. طيب? Stage 3 adjacent spread to the lower urethra. So imagine the lower part اللي هي lower urethra, anus and vagina with unilateral lymph node. Okay? So stage 3 there is adjacent spread. So it will spread locally. طيب? It will spread to lower urethra, vagina and anus with unilateral lymph nodes. طيب? Stage 4 bilateral inguinal lymph node, involvement of upper شوية. طلع في الميوكوزا of the rectum, urinary bladder, urethra or pelvic bones. Okay? Pelvic bones. Stage 4B, distal metastasis. Clear? So stage 1, less than 2 centimeter with no lymph node. Stage 2, more than 2 centimeter with no lymph node. Stage 3,
anus urethra.
yes,
lower.
lower urethra, vagina and anus with unilateral lymph nodes. Stage 4, and 4A, 4B. 4B, distal metastasis. 4A, bilateral inguinal lymph node with mucosa of the rectum, upper urethra, bladder and pelvic bone. خلاص؟ Clear?
تمام.
طيب. Treatment. Stage 1 and 2, radical excision with 1 centimeter free margin. طبعا هنا free margin is very important. إيش معناته؟ يعني if you do excise the bulk of the tumor طبعا لازم يكون تحت الاكسجين حقك 1 centimeter free، ما يكون في tumor cells. معناته your surgery is ممتازة. اوكي؟ طيب دائما يجي في أسئلة الهيئة إنه إذا كانت الليجن في النص. طبعا إذا كانت الليجن في اليمين تشيل المنطقة اللي في اليمين. إذا كانت الليجن في اليسار تشيل المنطقة اللي في اليسار. إذا كانت في النص، إذا كانت الليجن في النص الميتاسيس to the lymph node is very high. فهنا تكون beyond شوية يعني تصير more advanced في السيرجري. طيب we'll come to that. Stage 3 and 4 according to the general health. If she's healthy, you have to do excision and then you have to give her chemotherapy and radiation therapy. If she's not healthy, yani she cannot go for surgery because usually the patients are very old. فيكون عندها دائما comorbidity. فهنا you have to give her chemo radiation and then to shrink the size of the tumor and then do the surgery. Okay? طبعا ايش kind of the surgery is radical vulvectomy. Okay, I'll show you the pictures of radical vulvectomy with inguinal lymph node dissection. Okay, and then you do constructive surgery with skin grafting. طبعا it's very destructive surgery. Okay, because you are taking the whole vulva out, so it is a very destructive surgery.
هذه الأخيرة consultative surgery.
Yes, radical vulvectomy, and you are taking the whole vulva out with the urethra, with the lower rectum. عرفت؟ لأنه stage 3 و 4 metastasis صح للlower urethra والrectum وكذا.
طب أنا إيش تسوي graft ولا شلون؟
Yes, you have to do grafting
مع بلاستيك.
مع البلاستيك. Okay. طيب. So as we said, في the early stage, you do radical local excision. The more advanced, modified radical excision and sentinel lymph node biopsy. For advanced stage, radical plus, radiation plus chemotherapy or chemoradiation, and followed by surgery. طبعا if you do chemoradiation, you will shrink the size of the tumor, and then it will be easier for you to do radical vulvectomy.
معلش دكتور
sentinel هي الليمف نود اللي تكون positive في الفولفر كانسر. اوكي؟ يسووا فيها داي اللي هي راديو اكتيف داي يحطوها في الانجوينال lymph node, and this dye will spread or it will go to the lymph node which is active اللي راح لها الميتاستاسيس. Then you do excision to these lymph nodes. هذا اسمه sentinel lymph node. طيب. So what is the indication of chemoradiation? إذا كان عندك rectal involvement, urethral, bladder involvement. This one to shrink the size of the tumor and to avoid colostomy or urostomy. Okay. إذا كان disease spread to the bone, then you have to do chemoradiation before doing surgery. طيب. If there is inguinal or femoral lymph node involvement, لأنه بدأ systemic involvement, so you have to give her chemoradiation before doing the surgery. Okay? Clear?
Yes.
طيب. طيب. هذه تجي في الاختبارات فعشان كذا حطيت لكم إياها. Stage 1A طبعا partial vulvectomy. Stage اللي هي فقط للفولفا للاريا اللي فيها 2 سنتيمتر وتاخذ 1 سنتيمتر free margin. Okay? Stage 1B modified radical vulvectomy with ipsilateral groin nodule أول ما يوصل 1B. طيب اللي هي الحين احنا قلنا less than 2 سنتيمتر then more than 2 سنتيمتر صح؟ إذا كان من 2 إلى 5 هذه 1B. Okay? Sorry, from 2 to 4, I'm sorry. From 2 to 4 هذه 1B. فهذه تسوي لها modified radical vulvectomy. هنا لازم تشيل الليمف نود. هذه معناته modified radical vulvectomy. لازم تشيل الليمف نود. طيب كيف حتشيل الليمف نود؟ حتشيل حقة السيم سايد ولا bilateral؟ إذا كانت الليجن central تشيل الليمف نود حقة اليمين واليسار. إذا كانت الليجن في السنتر. أوكي؟ إذا كانت الليجن في اليمين تشيل الليمف نود حقة اليمين. إذا كانت الليجن في اليسار تشيل الليمف نود حقة اليسار. بس إذا كانت في السنتر سواء كانت 2.5 ولا كانت 3 ولا كانت 4 you have to take the both lymph node. Understood?
Yeah.
في اسمها
لا
استفادة.
واضح واضح.
واضح؟
اي.
طيب. عندك stage 2 modified radical vulvectomy with bilateral groin node dissection. Stage 3 combined. طبعا لازم تعطيها chemo radiation and then you have to give her the trial of surgery. Okay? يقولون لها pelvic exentration. هذه exentration صراحة very extensive 12 hour to 14 hour surgery. Multidisciplinary. لازم يكون الجاينيونكولوجي موجود، لازم يكون يوروجايني موجود، لازم يكون الجي اي بلاستيك ديرماتولوجيست عشان يعني يشوف الليجنز. ف تقريبا 5 إلى 6 ديبارتمنت يكونوا موجودين في نفس العمليات. أول شيء they will reconstruct الريكتم، they will reconstruct البلادر لأنه المفروض ينشال البلادر حتى. So they will reconstruct the bladder, they will put محالب, they will put urethra. So it's reconstruction. It's the whole plastic surgery from for the patient. الريكتم يعني سويت مرة البلادر من small intestine. We took about يعني small portion of the small intestine and then we make it as bladder. We attach it to a urethra, يعني new urethra, and then we put the stent عشان نسوي ureters, okay? So can reconstruction.
هذا شغلكم من شغل يورو.
سوينا مع اليورو.
اوكي.
Okay. يعني and the patient يعني she can do in and out catheter to empty the bladder يعني. Okay, because the detrusal muscle is not there يعني أساسا. But she will not sense it. So every 2 hours she will do in and out catheter. طبعا this is better for her survival يعني. I know the lifestyle is very difficult, but يعني it's better for her survival rate. Okay. طيب, this is pelvic exam. Either we start her with chemoradiation or with surgery, depends on the patient. Okay? So this is types of vulvectomy, which is there in the market. طيب. There are several operations. أول واحد اسمها skinning vulvectomy. Okay? This one, it will involve only removal of the top layer of the skin. Okay? It's an option for VIN3 اللي هي skinning vulvectomy. إذا ما كان في insitu. Okay? أول ما يصير insitu لازم تسوي simple vulvectomy. Okay? Or local excision اللي هي تحط 1 centimeter free margin. Okay?
Partial.
Partial. So simple vulvectomy, you will remove the entire vulva. Radical vulvectomy, you will remove the vulva and the deep tissue. Okay. هذه اسمها partial radical vulvectomy. Complete radical vulvectomy is the entire vulva, deep tissue, clitoris are removed. Okay. Okay, so and the complete radical, it's a removal of clitoris, also with the deep tissue and the vulva. Partial, there is no removal of clitoral area. طيب, block dissection, طبعا you have to remove the vulva and the old structures in block, يعني كده block, يعني remove it with طبعا lymph node. طبعا هنا يحتاج هذه reconstruction.